was diagnosed with COPD in 2005. Well, it's tightness of your chest and so on, and shortness of breath.
People who live with COPD or chronic obstructive pulmonary disease have a gradual increase in shortness of breath with activities.
I could never get quite enough air in my lungs. Kind of scary, kind of like suffocating.
You just couldn't catch your breath.
Almost 100% of the patients who come to pulmonary rehab initially are quite deconditioned, and many of them just feel terrible.
It was miserable. To walk a flight of stairs, I'd have to stop halfway to catch my breath.
I couldn't go more than 10 steps.
I'd been exercising, but I wasn't doing it properly. When I went to pulmonary rehab, they taught me how to exercise correctly and breathe properly.
Good morning, Bev.
The staff, from the minute you walk in,
How are we today?
they remember your name. They're just nice.
Have a good day.
And you know that what they ask you to do is personalized.
They start you out real slow, and you work up to where it's comfortable for you.
Everyone has to start somewhere, and we're going to work with where they're able to start at and then building upon there. Yeah, you're a little bit low at 89, 90.
We monitor the patients throughout the entire session. We take vital signs before, during, and after exercise, and we address any health issues or concerns that they have at the time that they come here.
Your prescribed speed, that's good.
You feel like they're all personal just for you, even though they're helping everybody. But that's what they do for you, and you can't beat that. Having that many people caring.
This is a very patient-centered program. We have a team of experts that's available for each and every patient who comes into pulmonary rehab. This includes a physician, myself, who sees every single patient, exercise physiologists, nurses, respiratory therapy, occupational therapist, a dietitian. We offer smoking cessation, a licensed clinical social worker who does counseling. Pulmonary rehab offers people help getting back to living the life that they desire.
So before I met with a dietitian, my eating habits were not very good.
This is a recipe that's full of vegetables.
I was able to lose my weight, about 45 pounds. But the side benefit was I was able to eliminate my cholesterol medication, eliminate my triglyceride medication, and cut my blood pressure medicine in half. Loved it. It was great.
Let's see if we can walk the line here.
It's very important to try to prevent falls in general, especially as people age.
The occupational and physical therapist gives you exercises to do at home.
Falls can lead to increased disability and even increased risk of dying.
I've improved a lot.
Medication management is another part of the program, is that they learn when they'll use their medications, how to use their medications.
After you kind of blow out the baseline, put that in your mouth, bite down on it, lips tight.
Specifically their inhalers and how to use proper technique so they're getting the most out of their medications.
It is a big step to start utilizing oxygen. You have a cannula on your face. You now have to deal with tanks and filling tanks and gases and liquid. So it can be overwhelming at first, but we try to get the patient used to it.
They somehow get across the point that so what? You're using oxygen, it's still you. There are many things that you can do, some that you can't, but more that you can. And that's the hope that I feel.
We allow caregivers to participate alongside their loved one.
It's always helpful to have someone come and exercise with you in terms of being motivated and having that support moving forward.
It is a tremendous privilege to work with patients in a setting like this where you're helping them to take back their lives.
They're always surprised how much stronger they keep getting, and that they think that they never could have ever have done this.
Almost 100% of the time, our patients are reporting that they're always feeling better, they're able to do more, and they have less shortness of breath.
It's a night and day situation. Wonderful. I've got stamina, I can do things. I don't have to use my oxygen during the day anymore. It's been great.
I'm able to do more in my daily life than I was before. I mean, my wife and I, we take this pickup and go wherever we like. We were in Texas earlier this spring. That's nice to be able to do that. It's one of the best things that ever happened to me.
I feel brand new, born again. And I really feel everybody should do this.
I recommend everybody do it.
Goodbye. See you.
It just gives you hope.
If you have lung disease and you have symptoms, ask your doctor for a referral to pulmonary rehab.
Get yourself in the door. You will not be sorry.